Good morning, everybody. Thanks to the organisers for this great opportunity to present this data, which is quite recent data that we've finalised. I think there's still some work to do, but this will be a snapshot into what we found so far. So we looked at the serotyping and the seroprevalence of FMD in cattle in Uganda for the period of 2014 to 2018. And this was a very, very fruitful collaboration with those partners from Uganda, Makerere University and the UVRI, as well as very good input from the ministry, and Minnesota University, us, and the USDA were collaborators on this project, funded by DETRA. So just as an introduction, many of you know this already, but FMD is endemic in many parts of Africa, causing significant losses with 6 out of the serotypes present in this continent, with the exception of Asia 1. This is probably due to animal husbandry systems, trade, as we heard just now, movement of people and animals, close contact to wildlife. There is poor surveillance, limited resources for vaccination programs, and limited vaccine matching information. So the aim of this project was to look at Uganda and to help with the progressive control pathway position that they are in, and for stage 1, the aim to get a better understanding of the epidemiology of FMD in Uganda and develop a risk-based approach. Uganda, as shown on the map, is landlocked country surrounded by Kenya, Tanzania, Rwanda, the Democratic Republic of Congo, and Sudan. So just as a little bit of background to the project, we have 2 aspects of the project. The first part has already been done, which is to actually look at the circulating viruses in Uganda, and these were isolated and sequenced, just to give you a bit of background before I show you the serological profiles. And in 36 districts of Uganda, there was circulation. The sequence analysis showed that there was A, O, SAT1, and SAT2 viruses circulating. For the serotype O viruses, which were isolated in 21 districts, which were most prevalent, they were classified into 2 East African topotype, East Africa 1 and East Africa 2, and further subdivided into 6 lineages in total. Serotype A virus was isolated, was Africa G1 topotype, and from the SAT1, we've got the 1 and 4 topotypes, and SAT2, the 7, 4, and 10 topotypes viruses. So a lot going on in Uganda, and we found that the SAT1 and SAT2 sequences from cattle clustered with ancestral sequences from buffalo, indicating this possible link to wildlife-livestock interfaces. Also part of this part of the project, the NSP ELISAs were done, and this has been submitted as a paper already and should be published quite soon. So I would like to move on to the work we have focused on, which is the serotyping. And just to give you a bit of background on the locations of the herds that we have targeted in this particular part, consisted of 34 herds, as you can see in the locations there. And just to say that this is by no means a total overview of the population in Uganda. This was a targeted type of sampling where outbreaks were occurring or suspected, and this is where the targeted sampling would have taken place. So this only represents 1,074 samples in total that were done. We have many more serosamples to still finalize that could potentially be from the random sampling that took place, which would give a better overall picture of what's happening in Uganda. But I think the message from what we can show here is really important. So what we had was NSP classifications, positive and negative, and we had vaccinated groups and non-vaccinated groups, and that just shows you the representation there of what we have. And we did the solid phase competition ELISA for the SATs, and then the prionics kits for the ANO. So the total seroprevalence of the subset of data showed a very high dominance of the O serotype, above 60% of animals with that, followed by the O, 40%, and then the SATs, and small amount of SAT3. If you look at and this obviously is vaccinated and non-vaccinated animals, the total amount for everything that we've done. If you look at the serotype distribution per animal, so this is not per herd, but per animal, you find that the majority of samples are just straight O serotype. Then there was followed by animals infected with both, or serotypes for A and O, And then there was combinations of O and A with SAT1 or with SAT2 or SAT1 and SAT2, which made up the most dominance of all the distribution of the serotypes we had there in the samples. So if we look at vaccination, which I must say is a really complex issue to dissect for this study, we try to look at different aspects of it. And so the total vaccination profile of animals that were classified as NSP positive versus NSP negative are presented here. And the vaccine that is used in outbreak situations is from a local producer, and it's a trivalent vaccine of the O, SAT1, and SAT2 serotypes. So if we look at the NSP negative results, which represents you're only vaccinated with no infection, supposedly, then only less than 35% of animals actually have antibodies to the O, SAT1, and SAT2 supposed vaccine strains. And then the NSP positive samples from vaccination, so this is when you have vaccination and infection possibility, 80% of those animals had the O serotype, followed by 55% with the A, and then the SATs to lesser degree. So if we further dissect this vaccination profile and we categorize the herds into the time at which they were vaccinated when sampling took place, we have 0 to 3 months at the top left there. And you can see the profiles there between NSP positive, lots of NSP positive, and the negative. And then similarly, we have 4 to 6 months. And if you look there, the profiles are the same ratios of serotypes to each other, even though there is different quantities of seroprevalence there. But just something to note is that the A serotype, which is present there in NSP positive and negative, is not part of the vaccination strains. So the fact that it's there is indicative of circulating serotype, and not. So it's hard to dissect which of these profiles are due to vaccination strains or due to just having antibody circulating in these herds before vaccination took place. So I went on to look at one particular herd of interest where we actually sampled on the day of on the same day as vaccination. So this would represent sort of baseline of what might be happening in an example herd. And if you look at this profile over here, you have got non-structural protein negative animals that have got serotype antibodies there. And already at this stage, more than 40% of the animals had antibodies to the O, SAT1, and SAT2 for the infected animals before the vaccination actually took place in this herd. So there was already, in this particular example, a lot of circulating antibodies before vaccination took place. Then similarly, if we take a herd that was vaccinated 2 weeks before the sampling took place, 60 to 100% of these animals have antibodies for all 5 serotypes for the infected animals. And is this a case of vaccinating behind the outbreak or from animals exposed to multiple serotypes in the last sort of 2 years? Or is this a case where your NSP negatives are almost false negatives and borderline samples that might have actually been classified soon as NSP positive? And then if we go on to look at a little bit of a different analysis where you look at the total seroprevalence of vaccinated versus non-vaccinated animals, so this would represent the mix of your NSP positives and NSP negatives, you'll see that there's not much of a difference between the total vaccinated groups and the non-vaccinated seroprevalence. So that's quite interesting. If we then look at the animals that are only NSP positive, so these are animals that have been exposed, but they are categorized either as vaccinated or non-vaccinated, there's again not much of a difference between these two groups, except for the fact that there's a SAT3 there in the vaccinated NSP positives. And then if we look at non-vaccinated animals now, so this would represent where you have potentially true outbreak scenarios or exposures where there was no vaccination. And there's a similar ratio between the seroprevalence of your serotypes for the NSP positive and the NSP negative. Again, in different levels, but similar profiles. So here, much less seroprevalence. And is this, again, an example of where the NSPs have just not gotten to a positive threshold yet and might be false negatives? Or is this something else that's a problem? So of the 8 herds that we looked at in depth for this, the most prevalent serotype was O. followed by A again, and then the SAT1s and SAT2s. So I just want to draw attention to an interesting scenario. We know that O is the dominant one, followed by A. But here is an example of two herds that were two of the four herds that I looked at, which had really interesting values with SAT3. We did not see SAT3 often, and in fact, in most of those other herds, there was no serology for SAT3. But in these particular two herds, which are actually located next to each other, there was really a high seroprevalence of SAT3 in the NSP positive animals here, and to some degree, a slight elevation there in that herd next to it. And similarly, if you go on to another district, just up from there, also two herds that were near each other, same area, they also had quite high SAT3 seroprevalence compared to any other that we saw. So this is just an interesting thing, because we did not isolate SAT3 from the study. Okay, so for the discussion, showed that, which confirmed the sequencing results, that there's a high seroprevalence for O and 40% for A, followed by the SAT1 and SAT2 serotypes, and this correlates with what was found. However, exposure to SAT3 has been seen in two areas with the four herds that were shown, even though that the general population seroprevalence is still seen to be very low. There's wide distribution of these antibodies to the four serotypes across the country where it was sampled, and this brings us to the problem of several problems associated with current vaccination in Uganda. But this is not just a Uganda problem, this is a regional problem, and to some extent can also be seen as a SADC problem, that data suggests that vaccination is often behind the outbreak, often when herds have high NSP positives and where the seroprevalence is already high for many of these serotypes. So the information from this project will help a lot to solve some of these problems. For example, vaccine matching. For the first time now, Uganda will be able to correctly look at what strains were circulating and match these to the vaccines that they have to possibly choose better matched vaccines for their location. The current vaccine only has those three serotypes, and I think there's a need for the inclusion of the A serotype in this region. And questions about the timely supply from the manufacturer or the national distribution to the affected area is really important. If you're going to vaccinate in the face of an outbreak, it needs to be quick, it needs to be targeted, it needs to be supplied quickly, and all those things need to be in place for it to be an effective strategy. They use primary vaccination in the response only to outbreaks, so there isn't currently a campaign which controls just by vaccination on a regular basis. So in the light of this, it is really even more important, if this strategy is to work, is to target it with very quick responses. And the effectiveness of the vaccine campaign, which someone mentioned yesterday in a presentation, there's a difference between efficacy of the vaccine or effectiveness of the vaccination campaign, has to be looked at, because I'm not sure if everything is how one would want it to be in terms of coverage or cold chain and those different aspects of actually maintaining the campaign. And it's not only the efficiency of the vaccine, which could still be a problem, but it's not to say that it's only the efficacy of the vaccine. Something that was highlighted with a discussion I had with somebody yesterday was the risk of subclinical infections and persistence due to this high endemicity that we have in Uganda and the fact that we have vaccination with that. So all is not lost there. I think it's a very positive story. I think finding these solutions, you have to find the truth of what's happening, and you have to identify where the risk is. So this has been done by looking at what was circulating in terms of viruses and antibodies. This can now be used for a very good risk-based strategy to really improve control in Uganda. And I believe the potential strategy ideas could be to perform an efficacy trial in the field, or maybe a few of them, using clean cattle or young animals, whichever is found. And this will be a very critical first step to look at the first baseline of efficacy of the vaccine in the region. Will it improve? Is it actually working for them? And then once they determine this, to move on to risk-based vaccination approaches. This could be to target your young animals first in the light of an endemic country, maybe to target cattle in your high-risk areas where movement, density, grazing, and borders are all got higher risk for them, or to target cattle at your interface, whichever is found as one of the highest risks to target first. And of course, continual surveillance going forward will be critical to keep understanding what strains and what movement you have in the country. So I thank you for your attention and any questions.